afternoon. We are with Dr. TLVD Prasad Babu, the Chief Surgical Gastroenterologist of Yashoda Hospitals. And we would like to discuss with Dr. Prasad Babu about the general problems people are confronted with regard to the gastro problems. It could be as simple as hyperacidity, or it could be as complicated as cancer, or it could be as simple as liver cirrhosis or fatty liver. So we would request Dr. Prasad Babu to throw light on the changing scenario of the ailments pertaining to the gastro field over a period of time, and what he has seen in his long experience as a chief surgical gastroenterologist. And he will also tell us about how to prevent or how to identify any problems we are confronted with and seek early medical help so that the problem doesn't get worsened. Dr. Prasad Babu. Dr. Garu, please tell us about what exactly are the general problems people face and how we can identify them and prevent them.
Sir, now the growing problems in our country in gastrointestinal diseases, first is the functional intestinal disorders. What nowadays we call it as irritable bowel syndrome or gastric upset. All these problems. Day by day, the number of people who are suffering with these functional gastrointestinal disorders are increasing. Why we call it as functional means, if you do a lot of tests, you don't find an organic cause. That means there is no blockage, or there is no growth, or there is no ulcers, nothing. But still they're complaining of a lot of tummy upset and decreased intestinal movements, constipation, all these things they present. We call it as IBS or irritable bowel syndrome, and a spectrum of disease we call it functional gastrointestinal disorders. In this, major contributing factor for all these surge in this sort of disorders is because of change in our lifestyles, and also we are not giving much importance for our personal health, not doing good exercise, and also a lot of changes in our food habits, like a westernization of food habits. Like earlier, we are moving away from our traditional habits of food consumption, moving more towards of processed food, and also the bakery items or pizzas. All this culture we are inculcating. These are all the things which are again pushing us towards the disorders which we used to see only in the Western population earlier days.
So what exactly causes this fatty liver, and is it only because of alcohol consumption this fatty liver problem comes, or is it general in nature?
Sir, it's very good question. Earlier days we used to think liver problem means it's mainly because of alcohol, or else sometimes like infection like hepatitis B or hepatitis C. But there's a growing concern in India, because slowly what is happening, the common problem is NASH, that is called non-alcoholic steatohepatitis, where the fat is getting accumulated in the liver in a person who is not consuming alcohol. Especially this is common in nowadays in the female patients where they don't take alcohol. What we call, they suffer with a disorder called metabolic syndrome. All these people they are little fatty. Usually there are a good number of people are diabetics. This because of the metabolic syndrome, what we call it as initial stages, what happens is the fat will get accumulated into the liver. There will be certain stages, stage 1, stage 2, stage 3. But certain group of patients will land up in a final stage called cirrhosis of the liver. What is happening is, since you are not doing a screening, or we are not detecting early fatty liver changes in the ultrasonography, suddenly they come to the doctor with a final end stage liver disease called cirrhosis. It is not exaggerated, but you can see in the future, in coming next decade, I think the probability of having a liver transplantation in India for a non-alcoholic diseases are going to be very high, because this is endemic. It is spreading rapidly in the country. And for this is very important aspect is community screening is very important. You have to detect early stage the fatty liver, if at all. If it is progressing fatty liver, they have to consult a specialist, and they have to halt the progression of the fatty liver to cirrhosis of the liver, what we call as end stage of liver disease.
For example, if a normally healthy person comes to you, what tests would you advise for him? What diagnostic tests can help him identify whether it is hyperacidity or liver cirrhosis or fatty liver or anything concerned with that? What are the general tests that have to be taken by the normally seemingly healthy person so as to identify the problems?
So these are important questionnaires pertaining to your any bowel habits. Any recent changes in your bowel habits are very very important question. Like you have a normal regular bowel movements and suddenly there is a recent change. That's a very very important aspect. But we tend to ignore it, thinking that okay, there's only probably normal like that and all. Second is people has to, even if they are healthy, family history is very very important. In your ancestors or father, mother, if in a family, if you have a history of cancer, any cancer or particularly abdominal cancer and all, these are all the group of people, they have to be under a screening programs from the initial days onwards, especially even if they are healthy adults also. Normal routine screenings are very important for anybody periodically. I suggest once in a year or at least once in 2 years, they should minimum basic tests like getting a sonography of the abdomen, where one can see like organs like liver, kidney. The solid organs can be evaluated very nicely with the sonography, and they can see some changes in the liver. All these things, very simple ultrasonography is enough. And naturally, once you are in the middle age, very important is doing a liver function test that gives how the liver is working, kidney function test, and also lipid profile, some thyroid. These are all the basic tests. One can keep you healthy. Suppose even if the patient is healthy, you can have hyperlipidemia, where which is a very important to prevent any heart diseases if you control the lipids. So these things, if you can just detect in early phases, where you can do some cure for this. So periodical health checkups are very very essential even in a healthy adults to detect any problems at an early stage.
We hear about, do we have any problems associated with diabetics? What precautions should diabetics, people suffering from diabetes, take in respect of the gastro health, as we call it?
Yes, sir. So now the diabetics, we all know diabetes can affect every part of our body, starting from heart. Again, it can affect kidneys, liver, blood vessels, all the nerves, all these things. It can get affected with the diabetes. So very important aspect in diabetes is not having diabetes is okay, but if we have a diabetes, control of the diabetes is very very important. Long-standing diabetic patients, the problems we come across in the intestine is the intestinal movements will come down, especially one entity called gastroparesis, where the stomach contractibility of the stomach will become less. So a lot of people, they say that once after taking some meal, they become little they full for a while and all, because after 4 5 hours they still complaining of still my stomach is full. So that is an what you call entity called gastroparesis. So these gastroparesis can be controlled by the good sugar control and doing an periodical regular exercises and healthy food habits. And also sometimes we use certain medications called prokinetics to help them to get relief about the gastroparesis, especially when they have suffering from the significant symptoms of gastroparesis.
Generally, we hear this complaint of being bloated at a full, we have this feeling of being bloated
Yes.
even after eating very little quantity of food. Is it related to the same problem what you are?
This is the one of the contributing factor could be diabetes, but these symptoms can be there in people who are not having diabetes. That is so. This is also this bloating on all these things also comes under entity called functional intestinal disorder. So in for this bloating, there are several causes. What we do is certain patients will have some ulcers in the stomach. We evaluate with the endoscope. Certain people can have a normal mucosa. Still, you can have a bacteria like H. pylori that we do a testing. So H. pylori, Helicobacter pylori is colonized in the stomach. This can cause all these gastric symptoms, also ulcerations. In long-standing, certain patients can cause gastric cancer also with this H. pylori organism. And certain people, we have a bacterial overgrowth syndrome where the bacteria can grow in the intestine. That can be diagnosed with certain hydrogen breath test. All these tests are there. So we go step by step for evaluation of these functional intestinal disorders. First, we rule out any organic causes. Then, if no organic, that is no organic pathology, then we gone down to various subcategories of the functional intestinal disorders. Then accordingly we treat the patients.
And then we are hearing more about what's a cancer in the abdomen and intestinal cancers. What is the first stage? How do we identify this? What's a cancer in the abdomen?
Sir, as you rightly said that there is a growing incidence of abdominal cancer in our country, sir. Actually, you don't believe nowadays we are seeing in a very young population, people with 20 years, 25 years also, we are coming across, I mean, like surprising diagnosis of abdominal cancers. Probably the changes in our lifestyle, food habits, all the food we eat is today is adulterated, and lot of usage of pesticides. All these things are contributing to growing increased incidence of cancer. Not only that, we all know our life expectancy is also increasing in our country. We are seeing a lot of geriatric population and all. So cancer is a factor where with a growing age, the incidence of cancer also will increases. So we are going to see a lot of increase surge in the abdominal cancer patients. The question which you asked about the how do we detect? So for a successful management of abdominal cancer, early detection is important. If you detect abdominal cancer in an early stage, there are a lot of options where you can do a successful surgery. You have an option of chemotherapy, radiation, all these things put together. We can conquer an abdominal cancer, especially if you detect it in a very early stage. So for this early stage, very important detection, important aspect is periodic health checkups, screening programs, and consulting a doctor. Even if a minor alteration in your regular bowel habits, so don't ignore. Always you should contact your doctor, especially if a sudden loss of appetite for a while, couple of weeks, if your appetite has decreased, if your weight loss is significant, especially if you lose a weight of around more than 6 kgs of weight in a 2 to 3 months, where you are not trying to lose weight, but you are doing normal life, but you notice there is a weight loss, and especially when you have a change in your bowel habits, and if you notice any blood in the motion, these are all some alarming symptoms. It could be some normal symptoms can be there, but this should alert you to reach a specialist doctor. They will evaluate, and I won't say every patient will have cancer, but you won't miss a patient with a cancer, and you can detect it very at an early stage, where still we have a lot of options to conquer these cancers.
As a surgical gastroenterologist, what advice would you give for the software employees and the new generation kids who depend more on eating outside? What precautions should they be taking? What will be your advice to them?
Important factor is the stress management and also changes in the food habits. We should stick on to our traditional food habits, which our elders have suggested. What we outside food definitely is not good. Eating regularly outside food, which are having lot of preservatives and also some chemicals on it, all these things. So always better to confine yourself more and more onto homemade food. That's important. Second thing is stress is another big factor, sir, for all these diseases and all. You need to cut down your stress, work time, and also relaxation techniques you should follow. And next is practicing some yoga. Very important aspect is exercise, physical activity. We have to make it a point every day. We need to do at least 30 to 40 minutes of time to do a physical activity. So diet, good eating a good food at from a good source, following stress releasing techniques, adequate sleep, physical activity. Follow these things. I think we can decrease the lot of these functional intestinal disorders. Not only this, and again the incidence of increasing abdominal cancers. All these things we can put a hold for these sort of disorders with following these healthy tips.
Thank you so much, Dr.
Thank you, sir.
Prasad Babu. It's been a great experience to talk to you, and we hope this will be useful for our viewers also. Thank you so much.
Thank you very much. Sir. Thank you.